During the past 12 months, PHCC has designed 3 approaches to reduce overdependence on medical solutions and improve patient self-management and adherence to care plans. Patients with advancing diabetes pose some unique challenges. Improved diabetes management can prevent serious complications and potentially reduce emergency department use and hospital admissions. This brief video describes our second approach, which is an internet-based platform with resources for care managers, clinicians, and patients. PHCC customized this approach for a fast-growing accountable care organization serving a large number of rural communities. As you will see, core components of this approach can be adapted for your unique needs. This approach includes self-management content tailored to a patient's specific complications, tools designed to enhance care managers' skills in identifying and managing these patients, an internet platform constructed to ensure simple and seamless access for care managers, clinicians, and patients. The approach can create opportunities for further integrating care manager supports and clinical care. A core piece of this approach is an internet-based index. Content segments focus on managing specific complications of advancing diabetes, lifestyle self-management, and information to help patients cope with difficult aspects of diabetes, such as understanding the value of insulin, signs of out-of-control diabetes and serious diabetes-related complications, and managing their life when serious health problems are causing end-of-life concerns. This index provides a link to each of these content segments. With very minor changes in the URL, patients, clinicians, and care managers can access these same resources. There are several processes for helping patients use the materials, including patients who do not have internet access. Skills and knowledge of care managers can vary in rapidly growing organizations. Another component of this intervention was to enhance the diabetes management capabilities of the care managers. Blocks of support materials were designed to address patient-centered communication and building effective care management relationships, complex adherence challenges faced by many new diagnosed patients, ACO members having difficulty establishing or working with a primary care physician, assessing if a patient has out-of-control diabetes or is at risk for a serious episode of care, and supporting patients with advanced illness care needs. There are several ways to use this care manager development content. Here we created links similar to the index sheet. Content can be easily accessed and revisited for training purposes. There are several other ways content can be constructed as on-screen tailored prompts to be used during live phone-based communications with patients. In summary, people with organ damage and advancing illness need more than generic diabetes education support. A number of complication-specific supports are included. This approach addresses the reality that care managers have varying skill levels. Care managers thought that having these types of content segments can increase the effectiveness and efficiency of their outbound contacts with patients. Situations that are difficult for patients to address are not only barriers to adherence, but can be challenging for their physician and other caregivers. The content addressed several of these situations. This approach can address logistical and resource barriers clinics often experience in supporting patient self-management. It addresses challenges experienced in rural communities. Additionally, processes were designed to support patients without internet access. This is only a brief overview. There are many options for adapting an approach to fit your needs. For additional information, please contact us.